Hi YouTube, it's Nicole. So today I wanted to discuss an issue that has been close to my heart pretty much forever, like since I was 10 years old, and that is birth. And my first birth with my first daughter, I have a daughter that's 16 or 17 months old now, and that was a C-section, and it was a necessary C-section. I don't think I was coerced. I don't think it was unnecessary. I know that it was totally necessary to have that C-section. Don't regret it at all. I wish that I would have had a birth plan in place, but you learn as you go. So now I am approaching the decision of when we want to have our next baby, and discussing having another baby is bringing up a lot of concerns for me, because I've never really considered having a repeat C-section. I've always been like, okay, you know, next time I have a baby, it will be a VBAC baby. So that means, VBAC means vaginal birth after a cesarean, and it is, I think it's common, I don't know, but I know it's common for women to attempt VBACs. But that's like so tough for me to like say that, because it's an attempt. So first, I guess I'm just gonna go into what I want for my next birth, and then we'll go from there. The way that I envision my next birth in a dream world would be that I would go into labor and kind of just be able to ride the waves of labor and kind of just close my eyes and go inside of myself and, you know, feel the pain and, you know, just kind of work through it and go through labor that way, you know, being just moving through the pain, or, you know, breathing through it, you know, doing whatever I need to do, being in whatever position that I feel comfortable, maybe going into the shower, maybe going into a tub, I don't know. But just finding something natural, a position that feels natural to me to be in, to give birth. I know that a lot of people that have been in labor are like, girl, when you're in labor, nothing's comfortable, and I understand that. But I do feel like mentally, I feel like in my head that it makes sense that if you are upright and you're kind of moving and you're, you know, opening up your body, that you're gonna allow the baby to move down through your body. So that is, I don't know, that's what I've kind of read and heard about. It's kind of also just like the way that I would assume that it would go. Obviously with a lot of pain, and it would be a lot of coping, but I would just, that's kind of what I want for my labor, is to be free moving and open, like a spirit of openness. And then after that, whenever it came to having the baby, I would want to, you know, once I push the baby out, I would want to have the baby on my chest and just have them look at me and me look at them, and connect with them, and, you know, latch them onto my breast as soon as possible. I don't really see it necessary to cut the umbilical cord as soon as they like pop out. You know, I don't know, and it and these are all things that I realize are very, very hard to come by in a hospital setting. And I've heard a lot of people say, okay, well, you know, that's a perfect plan, you know, for like a midwifery birth center. It would be perfect for a midwifery birth center if, number one, if there were any birth centers in my area. Number two, if midwives were allowed to practice independently of a doctor and independently of a hospital. Yeah, which that's not the case. It's a difficult thing for me to kind of come come to terms with, because I see birth this way now. I don't see it as, oh my gosh, okay, we gotta get to the hospital as soon as I go into labor, and then, you know, I gotta get into a robe and or a gown and lay down on this bed and get these monitors hooked up and just lay there while labor is supposed to be progressing, and have nurses come in and tell me what's going on with my body and tell me what's going on with the baby, and, you know, then a doctor come in and like kind of boss me around. Like, I know that that's not, like, that's a totally negative way to like talk about it, but I don't know, like, I don't know, like, something has changed inside of my head about the way that I view hospitals, and I just see it as like a medical thing. Like, it's a medical procedure to give birth in a hospital, whereas the way that I want to give birth next time is more like, I don't know, like, it's more of a natural, I don't know how else to say it, birth. Like, it's a birth of a mother just as much as it's a birth of a baby. It is a connection. It is, you know, there's so many hormones that happen whenever you go through a natural birth, and that get, you know, interrupted if you do have a C-section. And I don't know, like, there's just something that I just feel like is so magical about giving birth naturally, and that doesn't include having a nurse on this side, a doctor over here with a shield on his face, and you know, a fluorescent lamp hanging over your head, and, you know, these blankets that are never big enough or never warm enough, or you know, you've got to be in this uncomfortable gown, and you've got, you know, a bed that's like this wide that you get to lay on, and I don't know, like, it's just something that, like, I'm kind of struggling with, because on the one hand I have this way of how I see my next birth, and then on the other hand I have this concern for safety, and this concern where I'm like, okay, but at a hospital there's an operating room down the hall. If something were to go wrong, and, you know, the baby, they couldn't find the baby's heartbeat anymore, or if it was really low, or, you know, if I started having problems, if that were to happen, the operating room's right down the hallway. They've got doctors, they've got nurses, they've got professionals to sit there and take care of pretty much every situation that could come, and it could still end badly, but at least, you know, that's right there. And in that respect, I kind of like, I respect a hospital, because in an emergency situation, it's a great thing that they're there. But do I go for that, you know, even though there's tons of births that end up perfectly fine without intervention, and do I go there and risk losing my ideal birth for safety, or do I have a home birth and, you know, have a 95% chance that everything is going to be peachy, with that little, I don't know if it's 95%, just so you know, I don't know the exact number, but do I have that tiny chance where, you know, I might end up at the hospital, and that would definitely spoil everything. So I don't know, I'm so frustrated, because I barely know how to make sense of it in my brain, let alone, you know, converse with my husband about it, converse with my parents about it. And not that my parents have any weight in the decision, but it's difficult for me, because I want to make the best decision for my family, and I know the doctors would say, well, then your best decision would be to be in hospital with a doctor, but then, you know, there's lots of people out there that would say, well, you know, people have been giving birth since the beginning of time. That's how time has progressed, and they've, you know, there's obviously, we've got here somehow, and obviously the world is populated somehow, you know, even before there was all this medical crap. So, you know, so that's my dilemma. So if you have any constructive comments or criticisms, or just some encouragement for me, if you could leave them down in the comments area or contact me, that would be amazing, because we are not yet pregnant. We're not even like TTCing, we're not there yet. We're just thinking about it, and before I really am like down with getting pregnant again, I kind of want to feel a little bit more comfortable with the path that we're going to take. And it could change mid-pregnancy, it could change at 38 weeks, who knows, you know. But I just kind of, I don't know, I kind of want to be a little bit more informed, and I know either way, no matter how informed I am, it's still going to be a risk no matter what. But it's a dream that I have, and I'm kind of, I don't know, looking for guidance, I guess. So if you VBAC'd or if you HBAC'd or any of that, or if you've tried and it hasn't worked out for you, whatever. If you would like to share your story, you can either post a video feedback or you can post a comment, and I'd love to read them and I'd love to hear your stories. So thanks, and I'll see you again sometime soon. Bye.